Now, we've covered a number of topics on THC, and I have to tell you that this is a topic that is an ever-moving target. And I just want to let you know that because we're going to see a lot of changes coming in the future on this particular subject. And I hope we covered a lot of them in depth. But let's go through some of the questions that you asked prior to the webinar, and then we're going to get into the questions you're asking during the webinar. First question is, if THC beverages are derived from hemp, at what point does chemical conversion or extraction render them synthetic or controlled? Well, first of all, hemp products as well as marijuana products are natural products. When they are processed, and by the way, please feel free to tune in to one of our webinars, like the webinar we're doing next week on cannabis as medicine, and also our webinar on cannabinoids itself. Because what we do is we talk about that conversion process. So in many cases, you'll have hemp or cannabis run through a process where they'll use a freeze-dried method, or they'll use some sort of a BPO, which is a butane method, which converts or strips the cannabinoids from the plant and puts them into a form where they can be turned into a product. Now, because we're just taking that natural product, in essence, think of it like, plucking blueberries, or think of it like plucking an apple off a tree. All we're doing is taking those, putting them into a bottle, which is then processed depending on the type of product that they're going to make. And that keeps that as a completely natural product. Is it controlled? The answer is yes. Every step of the way that in the manufacturing process of a hemp or a cannabis, a marijuana plant, has safety factors in place. And that's why the certificates of analysis are there. So you know exactly the process it goes through, if they've tested for molds, pesticides, if the environment was clean, and also if the product that's put out is a clean and clear product. Now, synthetic products are completely different. Synthetic products like GW Pharmaceuticals, products are made in a lab. They're made from a chemical process. They are made to synthesize cannabis. In other words, in many cases, all they're doing is synthesizing one of the molecules. For example, THC. They're not bringing you the terpenes. They're not bringing you the cannabinoids. The CBD. They're not bringing you any of the flavonoids. So in essence, it's a chemically rendered product. So THC beverages are not synthetic. They are controlled from the standpoint that there is a safety or a health regulation behind that. But in many cases, these products are very natural. Next question is, can THC drinks interfere with epilepsy medication? Well, first of all, anytime you're on any medication and you're using medical cannabis, I suggest that you do talk to your doctor, because what you want to do is make sure that you're not having that interaction that's there. The answer is it should not affect your epilepsy medication, although it depends on how much of the epilepsy medication that you're taking, and it depends on your metabolism. Now, I suggest that what you first may want to do is talk to your medical cannabis doctor to find out if there is any interactions, or your actually medical doctor to find out if there's any interactions that he can see. I want to be very safe on this particular issue. There should not have any interference with it, although again, it depends on your metabolism and it depends on the type of medication that's there. And since I don't know this, it's hard for me to define that definitively. Next question is, can THC drinks impact heart rhythm, especially for people on conditions with AFib? And the answer is yes. The only area that you have to be extremely careful with drug interactions has to do with heart medications. And that's because cannabis is transported through your bloodstream in your body. And by doing that, what happens is it does affect your heart, and it does affect your heart rate. In many cases, there are times when you first start using cannabis, your heart rate will go up a little bit, somewhere between 5 to 10%. And then, interestingly enough, after about 15 minutes to 20 minutes, they found that your heart rate, and sometimes even it could take as long as an hour, your heart rate will go down because your body relaxes. So it does have an effect. I would say, again, in this particular case, if you have a heart rhythm problem, I would do exactly the same thing as I suggested with our epilepsy friends. First of all, talk to your medical doctor or your medical marijuana doctor. Medical cannabis causes your body to relax, but in the relaxing process, it causes your whole system to go kind of expand a little bit, and then be able to actually come down to be able to process and be able to transport cannabis through your blood system. Question is, what drink would you recommend for arthritis pain, especially in the hip? Well, a lot of these drinks, one of the things that works very well for arthritis pain are drinks that have some CBD in them. CBD is wonderful for inflammation. And as we noted in the webinar presentation itself, THC does a good job on inflammation as well. But the interesting part is that when you put a little bit of THC with some TBD, it basically energizes or puts both of the strengthens the medical efficacy of both of those products. So what you'll find is if you find a product that has both CBD and also THC in it, you'll find that it'll actually be better for your arthritis pain than one with CBD only. And that goes for edibles as well as cannabis, other forms of routes of administration. So I would say the answer is yes, they will help with arthritis pain. I have arthritis. I use these products, and it does help with my pain. It also helps with my inflammation. The key is to get the inflammation down because that's going to be the key to help you with arthritis. And I do want to point out we're doing a webinar on arthritis in the end of February. Please join us for that. Next questions are THC drinks made from things like RSO, and do they include terpenes and strain types like indica and sativa? Well, RSO is a particular way of processing cannabis. And RSO has a particular nature to it. It is extremely powerful, but it's also very good for cancer, for pain, for inflammation. It's kind of like the remedy that helps your whole body. The drinks are not made from RSO. RSO is, again, a different manufacturing process altogether. There are some of these drinks that also do have terpenes in them. Not all of them do. I would say probably about 20%, 30% of these products do have terpenes in them because when they're making those nanotechnologies, it depends on the process that they're actually using, if they are using nanotechnology itself. Now, by being able to do the processing, which is the way they actually produce the product, it really takes the concept of indica or sativa and really challenges that. Indica is one where you want to relax. Sativa is when you want to energize. And you will find that these products, in most cases, are indica type products where they will relax you. Although there are a few of them that you'll see that are out there and they're really labeled and marketed as to be, in essence, energy drinks. And these are ones that are more what they call sativa leaning strains. So it depends on the objective of the manufacturer. Does he want to have a relaxing product, which most of these products are designed to do, or do you want an energizing type product, which you'll see on the market? And again, they do a great job of that. I tried a 50 milligram can, and it gets your attention. Let me put it to you that way. It'll definitely, you want to get energized, you got it. That works very well. But be very careful. I am an experienced cannabis user. I know how to handle the situation. I would not recommend a 50 milligram can for anybody other than people who are very experienced with cannabis. Stick to the five, maybe go to 10, and then move on from there as you know what your sweet spot is. Let's jump to the next set of questions that we have. Why can't you purchase THC drinks from a licensed dispensary? Well, the answer is here in the state of Florida, in order to sell a THC drink, you have to have a liquor license and you have to have a certificate to sell hemp. Most of the dispensaries here in Florida do not have a liquor license, and that's the biggest problem that they have in selling products. Also, there are some dispensaries that have picked up a liquor license and a hemp license, but the state of Florida is actually slow. Let's just say they're slowing down the process of approving them. In other words, I know most of the licensed dispensaries have, in fact, applied for them, but they're slow dancing it until after November to basically stop these drinks from being able to be sold through licensed dispensaries. What's the typical absorption time for THC beverages? Now, I've seen a couple of typical times. For example, nowadays we'll tell you that it's 20 minutes. You'll find a company like Palermo will tell you that's approximately 10 minutes. I personally like a product called Willie's Remedy from Guess Who, Willie Nelson, and he'll tell you his absorption time is about 10%. And it really has to do with the way they manufacture the product, the nanotechnology that's really out there. Now, again, that depends on your metabolism. Some people have a slower metabolism. It could take 30 minutes, could take an hour before you feel something, just like an edible or just like a gummy or a brownie that you find that's out there, that's really out there. But the typical time is going to be maybe 10 minutes, 20 minutes at the max. You'll feel them right away. I know that when I grabbed my first can, which I bought, which was a 10 milligram drink, I felt it within the first 5 minutes. I thought it was at a great absorption rate. So I think you'll find it right away. You'll feel something. They typically have a rate. They typically will last anywhere between 1 to 3 hours, depending on your metabolism. That's kind of the duration time that you'll really see that's out there. Next question is: many folks have ceased or decreased alcohol intake and now utilize marijuana products. are there liver risks with THC, CBN, and other products? The answer to your question is there is no risk. In fact, if anything, it's quite the opposite. What these products do is help to basically restore and to put your body back in what they call homeostasis, which is which is called your body back in balance. It's been great to help restore your organs, like your liver, like your kidneys, like your lungs, that type of thing, to be able to put them back, restore them back to, let's just say, a state where they're they're healthier than they were before, and maybe overcoming a lot of the conditions that are out there. Alcohol. I mean, to be candid with you, alcohol is a poison. I mean, that's why you don't drink it straight. And when you drink too much of it, you know the side effects that are there. These products don't have healing properties and don't have that poisonous property that's out there. Now, I'm not anti-alcohol. I obviously drank it all my life, still drink it today. But I think that what I have found is these products are much easier to drink. They have less of the side effects, and I feel much better using them. So it's something that you may want to take a look at. And again, I would not worry about the risks. In fact, if anything, these have a lot of properties that can help with your medical condition, and medical cannabis can actually do that. Next question is, do you expect THC infused drinks to remain legal in Florida and elsewhere? Actually, there's a glass empty and there's a glass full. I'm a glass full kind of guy on this one. There is too much demand and too much money to be made for people like the alcohol companies and states to tax to walk away from this opportunity. Also, hemp is a very important product. There are something like 23 states that actually rely on hemp as one of the major, not the, but one of the major revenue sources for the state, and that includes the state of Florida. So I think what you're going to find is, I think you're going to find there's going to be a lot of bad legislation coming out, to be candid with you, like the one I pointed out. You're going to find there's going to be public reaction to that. You're going to find it after a time, whether that's going to be a month or 2 years, they're going to fix all that. But I do think that they'll remain legal here in Florida. And I do think it just boils down to money, to greed. I mean, you can't walk away from this market and not expect the politicians to be able to be able to react to it. And I think the other side of it is people want these products. I've seen some amazing statistics in preparing this webinar where the amount of THC drinks being sold, like for example in liquor stores, are surpassing the liquor sales, which I find very interesting. And I did not realize that liquor sales have been going down the last 10 years. A lot of people are really paying attention to alcohol and really recognizing it for the product that it is. So I think they're going to stick around. But again, I'm a glass half full guy, and probably by the end of the year, we'll find out where I stand on that particular one. The other question is, what's the deal with THC drinks that Circle K gas stations are now advertising heavily? Are they something to avoid? Quite the opposite. Now, here's what I am going to point out. Circle K is a gas station. There's a number of people walking in that are buying 6 packs of these drinks, taking them home and enjoying the evening, just like they go to a liquor store. So not only are they going to be advertising them, but other companies will start doing this as well. Let's jump to some of the questions that they have for the live questions that really came out there. Let's start with the first one. Can that cause constipation? It seems like gummies cause me to get constipated. So I was wondering, thank you. Okay, so the question is, can these drinks or can hemp cause constipation? That really is a function, Keith, of your metabolism. Any medication, whether it's cannabis, meaning marijuana or hemp, or pharma drugs, all depend on your metabolism. Now, you've heard the famous line the doctor says, take 2 pills and call me in the morning. That's because he's giving you the lowest possible dose of that particular medication that the doctor knows probably won't work. And you got to call him the next day to get the dosage adjusted. In the case of cannabis, if you try the lowest possible dose, you can actually take a little bit more to find out what your sweet spot is. In fact, that's what the whole dosing process is all about. That's a cheap, or actually it's a back way of saying the last webinar we're giving this quarter is going to be on dosing. Please join us for that. But you'll be able to see how being able to increase your going low and going slow can help you find your sweet spot. Now, with respect to your question about constipation, because your body is getting into a mode where it's basically relaxing, cannabis restores a lot of the natural properties of your body. And what's happening is as your body relaxes, it does cause that particular condition to potentially be the side effect that has to do with your metabolism. Here's what I would recommend that you do. First of all, if you get one of these products, buy a small, they have like shot bottles and things like that. Try one of those. See how that really affects you. This is a very different process than gummies. Gummies are typically made from are not nano-based products. These are nano-based products, and in many cases, people metabolize nano-based products much better than they metabolize just regular products. So give it a shot and see what happens that are out there. Next question is from Anonymous. Do these drinks affect epilepsy patients? Can they trigger seizures? Can it stop pain? Can it stop pain management medications from working effectively? Well, there's a couple of questions wrapped in here. So let me kind of unwrap these questions and be able to answer them for you. Do these drinks affect epilepsy patients? Well, these drinks affect anybody. Anybody who drinks one of these things should feel more euphoric. And it depends on how much you drink. It depends on the time frame of your body metabolism. Do they affect? So they do affect the patient. Now, patients with epilepsy themselves are found, the doctors, in fact, just recently, there's been 5 different studies done, both in Germany and also in Canada and Israel, that have shown that epilepsy is really, it can really be treated very effectively with a combination of high CBD and THC together really help the epilepsy patients. The problem with this particular product is you've got high THC and lower CBD. So they will affect you, but they probably won't give you the relief you're looking for if you're an epilepsy patient, as you would by taking let's just say a 9-to-1 or a 9-to-1 meaning 9 CBD to 1 THC product for epilepsy that'll help the patient a lot better, which is a tincture, for example, that you can be able to purchase. So they will affect you, but just be careful. It's not going to be, probably won't be a negative effect. It will get them, it will get you to relax. And one of the things about epilepsy patients is to be able to get the receptors to be able to relax that causes the problem. And again, this is such a new category. There's not been a lot of studies on it, but just my knowledge of epilepsy and these products, I would say go low and go slow, and you'll be able to find it there. Can they trigger seizures? Well, if anything, it does the opposite. That's why you probably heard of Charlotte's Web, where CBD came out, and the product was made to be able to help epileptic patients. And CBD was found to be the thing that helped quite a bit. I have friends and patients that have used CBD with THC effectively to address epilepsy. And I think it's not a matter of triggering the epilepsy. What it does is it helps remove or be able to reduce the amount of seizures or the intensity of the seizure itself. Can it stop treatment? Can it stop pain treatment medication from working effectively? I don't know what pain treatments you're taking. I don't know the medications you're taking. I don't know if you know you're on. You could be on a range of drugs from opioids, Percocets, Advils, aspirin. There's a number of things that really fall into that category. You're going to find that you're not going to have any interactions with these medications. What it's probably going to do is it's going to intensify the medication. In other words, they're working on the same receptors. CBD works on the same receptors as a lot of the pain medications. And so you'll find that you'll take less of the medication to get more of the effect. And that's one of the things that you'll probably find. So is it going to stop it? The answer is no. What it'll probably do is it'll probably accelerate it. Go low and go slow, because that's how you're going to be able to tell. Again, I don't know the medication you're taking, so I can't give you any definitive answers. But go low and go slow, and I think you'll find it will help you with pain and with medication. I know that I'm partial to something called Willie's Remedy. I know it's Willie Nelson, but he does put out a great product, and I've tried 6 or 7 different products, and I think his is probably the best. And he has a high concentration of CBD in his product, a higher concentration than most products that are out there, and I find it helps me quite a bit. Another question is, how is Torch able to sell 60 milligram cans? Are they very dangerous for patients on anti-seizure medications? First of all, let me back up. I think these things, the 60 milligram cans are dangerous for any patient, whether they're on seizure medications or not. That's a lot of cannabis at one time. And in one can, like I say, I found the 50 milligram can that I tried, definitely got my attention. Let's put it that way. So the answer is, first of all, there's no restriction as to the amount of hemp THC that can be put in the can itself. Now, I do want to point out that the more milligrams that are there, it's going to have a higher reaction to you. So be very careful. When the concept of going low and going slow, this is exactly the opposite. Okay, you're going very fast and racing. So I would say because there's no limit as to what you can put in the can at this point now today, that's how they're able to sell it. Are they dangerous? Yeah, I think, and it is. It doesn't have to do with anti-seizure medications. It has to do with, in general, don't go drinking and driving. I would be in a place where you could be fairly safe. I would know what my tolerance is to cannabis before I started jumping into one of those things, one of those cans, because you can find it can definitely get your attention. But the answer is there's no restrictions, and so that's one of the things that, again, a lot of the lawmakers are trying to figure out how to monitor that, and hence why they said no more than 4 milligram per can. That's one of the reasons why that was made. Now that's an impractical regulation, 4 milligrams per container, because if you have a bottle, 750 milliliter bottle, you obviously want to have more cannabis in that than a can of the six can of soda. But again, this is where the laws and the hopefully we get some lawmakers that will listen to medical cannabis people and people who know what they're doing to be able to put this together. Unfortunately, today, this is not the case. And so we're getting these crazy laws that are all over the place. Which THC seltzer do you recommend? Cheryl, I'm not trying to avoid the question. It's just I have not tried that many of these. I mean, literally, when I walk into places like ABC Liquor or a number of these liquor stores, and the amount of products are overwhelming. I mean, there's probably 30, 40 brands that are out there. So I haven't really tried a lot of these, and so I can't recommend one because my use of this has been to go to the bottled drinks. So I use nowadays I use Palermo, I use Flora. I've tried those. I've used Willie's Remedy, and then I usually mix them with ginger ale. I'll mix them. I'll take them straight ginger ale. Put them with iced tea, things like that. So that's been my way to go. So I'm not trying to avoid you, Cheryl. I just don't know. So I'm not going to give you a bogus recommendation. It's really out there. Can these products or edibles cause increased cholesterol? The answer is these products are fairly straightforward, meaning they're very natural products. So you probably aren't going to see, if you look at the ingredients in the cans themselves, it should not raise your cholesterol level. Now, again, this depends on your body. Edibles, however, can, and that's because it depends on the type of edible that you're purchasing. If you buy an edible from a Florida licensed dispensary, there's a good chance you won't see an increase in your cholesterol. In fact, if anything, it might help address your cholesterol issue. The opposite happens when you buy a edible from, let's say, that's not regulated, that isn't tested to the same standards, like at a grocery store or from a hemp store or a head shop or something like that. Those products, because the testing isn't as stringent, I tend to be very careful with them. In fact, I tend to avoid them because I want the best possible testing. I want to know what's going in my body, and that's what's important to me. So that's what I want to really take a look at. So the answer is it should not cause a problem with cholesterol, but it depends on your metabolism. Edibles more than the THC products. But again, pay attention to getting a product that has some CBD in it, because if that's the case, it'll really help address your cholesterol issue. And I want to thank everybody for joining me tonight. I know this has been kind of a informative little webinar. We've tried to provide the facts with respect to THC drinks. Again, the political climate is moving very quickly, so I don't know exactly how to answer that. We'll find out more towards the end of the year. But I do want to mention that these products are worth trying. I've enjoyed my experience with them. To be candid with you, I've almost stopped drinking alcohol because of it, because I found it to be a very satisfying experience. For example, Palermo puts out a product called Agave, which is just like tequila. So if you're looking at making some margaritas, give that a shot. I know Willie's Remedy has more of the lime and lemon flavors to them, and kind of is like a lime flavored or vanilla flavored vodka that's really out there. It really helps work really well. So anyway, I hope that really helps to be able to address some of those issues. I do want to thank you all for attending tonight. I do want to mention, if you're looking for a medical marijuana card, please check out the Medical Marijuana Treatment Clinics of Florida. They not only do a great job of getting you a card, but they do a better job of supporting you after you get your card, of being able to have a positive experience addressing your condition. And I want to thank AIR for sponsoring this webinar. They do a great job. They don't sell THC drinks, but they do a great job in the medical cannabis business and have some very experienced and passionate bud tenders that can help you address your medical condition. And naturally, I want to point you to Medical Marijuana Aware and Marijuana Aware, where we have products that be able to, educational products to really help you both in these webinars, and also go check out our YouTube channel that's out there. I want to thank you for joining me. Please join me next week. We have a very informative webinars on understanding cannabis as medicine, and I think that's getting followed up by talking about medibles, which are edibles, and also the terpene toolbox. Thank you very much for joining us.